Hello, motherfuckers.
Yeah.
We're recording.
Okay.
We're here. It's episode number 16 today. We are here
Sweet
with
16.
Dr. Jarrett.
What's up, everybody? Excited
Dr.
to be here.
Jarrett is the shit.
Yeah, he's...
Beep. Are we allowed to curse?
Oh,
yeah, you could do
We're
whatever you
allowed to
want.
do anything.
This is your podcast.
We can
Yeah.
do it. This is why we have the podcast, so we can say whatever we want.
Yeah.
So let the words flow.
I'm actually excited to have Doc here. I've been wanting to have him here for a long time now, so I'm happy that he's here.
So excited to be here. I'm originally a Jersey boy. I moved to Miami about 4 years ago and originally was an anesthesiologist in the hospital. And I switched to aesthetic medicine about a year ago, and I couldn't be happier. It's been a nice, long transition, but it's been fun.
Mm-hmm.
Nice. So, go ahead. You were going to ask a question.
Do you think? I mean, you know what? I always talk over everybody, so you start.
No. So, when did you know that this was a passion of yours? When did you start this? And you woke up one day. You said you wanted to be. How do you explain what you do exactly?
Well, in high school, someone...
And make sure you just talk right into the mic. Sorry about that.
In high school, I had mentioned possibly becoming a doctor, and someone's like, you can't do that. And so I was like, well, then watch me. That's actually not why.
Why did they say you can't do that?
No, I'm just kidding. When I was in high school, I was considering different specialties, and I always admired physicians. It always seemed like there's so many things you could do to help people. It was challenging. You definitely have job security and a great lifestyle. Financially, you'd always be stable because there's always a need for healthcare practitioners. And it just seemed like a superhero kind of role. When I was a kid, I also wanted to be an actor, but I felt like it would be a huge gamble to pursue this. And even if I gave it everything I had, I might not be successful. But I figured if I tried my best and worked hard and studied hard, I could succeed at being a doctor. And in a sense...
Well, you were on TV too, so...
In a sense, I've been able to do a little bit of both. So.
Yeah, that's why it was difficult for me to be like, what do you do? Because you do a lot. So yeah, how long you been doing this for?
So I did about 13 years of school, 4 years of college, pre-med, 4 years of medical school. I also did a master's in nutrition, and then I did 4 years of residency in anesthesiology. And I've studied for a couple years now doing aesthetic medicine, which is basically the art of anti-aging in a physical form, essentially being able to...
Simply saying here to make everybody understand Botox and fillers and all that shit we love.
Yeah. Well, as we age, we lose volume in our faces, our skin elasticity reduces, our fat pads shrink, we lose a lot of collagen, and our skin gets droopy. And so now it's a booming industry. We want to do everything we can to help someone look in the mirror and feel like their younger self. Being able to take a few years off of someone's life, not change their face, but just enhance it, can really boost someone's self-esteem.
Definitely. I'm just going to let you know that I share everything and anything with my followers. So you are more than happy to say anything you've done on me. I have no secrets. And I'm going to say I found you during COVID. Like, I actually found you on Instagram because you're funny. I found like your kind of humor stuff and I started following you. Didn't really think about like what you actually did. And I had somebody do the stuff on me, and this person that I used to go to canceled on me on my week of my competition, because I usually do fillers, lips, everything for my competition. And freaking out. I was like, what do I do? Like, what the fuck do I do? And I remember I contacted you and I was like, yes, what do I do? And you got me in. And I remember that the first thing I thought was, I was so surprised how not painful it was with you, because it had hurt like hell. Every single time I went to I've tried different people, and it was always very painful. And, I didn't really care. I was like, it's fine, it hurts, but I'm fine. And it would take so long. I swear, this lady I used to go to for lip filler, she took like a fucking hour or something. I went to you, and it was done, and I was like, whoa. What the fuck did he do different, And then ever since then, I only go to you.
Well, I would be a terrible anesthesiologist if my patients felt pain. So the topical numbing cream is fantastic. We use a BLT cream, basically betacaine, lidocaine, tetracaine, 3 different types of local anesthetic in various percentages. And it's super strong. If that doesn't work after 10 minutes, I'll put a second coat on. If that doesn't work, then I'll probably do a dental block on someone. Similar to a dentist would do before dental procedures. You block the mouth in 4 quadrants and you're 100% numb. The problem with that is you're so numb that you're and then I'm like, wait a second, is there any asymmetry in this area? Because I can't tell because their lips have shifted. So, and that's a little bit of an overkill. But thank you. I pride myself on giving the best outcomes for my patients. I don't want anyone to feel any pain. I want them to feel like the best version of themselves and maybe just a little bit better.
You're also fast and a perfectionist. I love it. How you just like stare and wait, maybe it's not perfect. I was like, I love that.
It's always fun when Maaxx and I are together because it's like 2 perfectionists in one. So it's like 4 eyes looking and it's like we both have to be happy with it. We usually succeed.
I'm very happy.
You know what I like about Doc is I remember going out with him not too long ago, and the lady came up to him and she's like, "Do you think I need any type of fillers?" He looked at her face. He said, "No, you don't need anything. I don't need to work on you."
Oh, that's
and
another
that
thing.
is huge because a lot of doctors would be like, "Yeah, you know, I'll work on you when that patient necessarily doesn't need anything." You know, so I'm glad you're going to elaborate.
I like that too when you do my lips because I know I've asked you before, should I do more? And you will say, no, I think it's good.
Yeah.
You know, I think.
I had a patient yesterday also who was concerned about a little bit of fat in kind of the pre-jowl area. And
what's pre-gel area?
Pre-jowl is basically, so we have our nasolabial folds that come down over here. I brought my little handy dandy.
Awesome.
Ooh, yeah.
But she doesn't have any pre-gels, so this is going to be a terrible example. Essentially, when we age, we start to lose volume, as I explained previously, and the skin starts to droop down. And you start to see the jawline actually get obscured and kind of blurred out by like fat that kind of comes over. Yeah. And so if we're able to lift that up and tighten the skin, then you'll see, actually, I have the nasolabial folds right here, but soon I'm going to erase them.
Okay, let's ask this though. How old are you?
I'm actually 65. It's just the Botox is working really well.
I love this guy.
Yeah.
I'm due.
Maddie, it looks like you have
the
nothing
3-month
done.
Benjamin Button wonder drug.
Do you mind saying what you do yourself?
Yes. So I started doing Botox on myself when I was 32. I'm 36 now.
Wow.
And
we're the same.
Yeah,
What's your birthday?
December 30th, Capricorn.
Wait, I knew that because mine is December 15th.
85. I made it by a day.
He's the sign man over here. He can tell you future
Capricorns.
later.
Yeah, we'll talk about that in a minute. Go ahead. Sorry.
Okay. Pin astrology for 5 minutes. So I started off with Botox, and I thought this was really cool. I was able to like completely smooth out my forehead, my glabello, which is between the eyebrows, your frown lines, and the crow's feet over here. And from there, I didn't do any fillers for a couple years, but about a year ago, I did my jawline. And recently, you wouldn't know it, but I actually have 8 syringes in my face right now.
Wow.
But
Really?
when you place a little bit everywhere strategically to replace volume loss, it looks completely natural. So I have a syringe in each temple. I have a syringe in each cheek. I have a syringe at the gonial angle.
This is fillers we're talking about,
Fillers,
right?
yeah. And a syringe in the chin.
Do you think, because you have a beard too, so it kind of hides a little bit, but you still notice a big difference?
Yeah, absolutely. You don't want to notice a big difference.
Oh, no, you yourself.
Natural
when
and subtle.
Yeah.
Oh, absolutely. I'll
What
throw up a photo if I can on the video of my before and after, and it is shocking.
Yeah.
Yeah.
I think so too, because what was it last week? You put fillers. I had 2 bones sticking out of my nose, so you did.
What bones? I don't see any bones.
Exactly. They're gone. And it looks so good. No swelling. I'm like a tiny, tiny little bruise on it. But, oh no, I'm so happy. I can't see the bone. They've been bothering me for so long.
Yeah, it looks great. And just to go back again about like, when should you start treating? What do you need? I tell 99% of the time, I tell people they don't need anything. If I say you need something, you need it. Okay? Basically, if you have severe deficits that are starting to show your age or older, if that bothers you, then it's time to do something about it. If that doesn't bother you, there's absolutely nothing wrong with aging gracefully. Yeah. So, you know, if your temples start to look too concave, you want to have a little concavity there because you want to see the borders of the cheek popping on the sides as well. But if your temples are sucked in like that and your midface is completely pushed in and flat, your tear troughs are hollow, dark looking and making you look tired all the time, if your lips are just dehydrated with lines all over them and they're kind of like sucked in like, oh, which lady lips?
Those were my lips before.
And if from the side profile, you look at your nose, your lips, and your chin, and they're not lined up, that's okay for you potentially. You don't need to bring the chin forward in line with your lips and nose. However, aesthetically speaking, what we find more physically attractive on people is to have a nice line being able to be placed between the chin, lips, and nose. When I've restored symmetry and alignment on lots of people, it sometimes makes them more physically attractive, but not always. Your asymmetry in your face can be part of your uniqueness.
Now, I have a question. What age could you start doing fillers? Because I see people at different ages starting. Like, is there a certain age you should be doing this? Like, what's your?
I've never touched a face under 18. I feel like I need parents' consent for that.
You think 18 is a proper age to start doing fillers?
Good,
what do you
depending
think?
on the person, right?
I think it depends on the person. If a girl was 18 and she had very, very tiny lips, but she wanted maybe a half a syringe to just give her a little bit more plump, a little bit more size to her lips, absolutely.
Or you got a freaking broken bones in your nose. Like, I mean, I'm older, but still.
Yeah.
If someone has a recessed chin that's really far back, and it's just making
Say right here, talk right here in the mic, just in case.
If someone has a recessed chin that's very far back and a weak jaw, then you can argue at 18, maybe this person's getting made fun of in school. So if you can do something non-surgically to help enhance them that can last a year and they can get a taste for it, see if they like it, I think that's amazing for someone's confidence.
Now, I have another question for you, because you're the specialist, right? You're the doctor, but sometimes when, obviously from my perspective, when I look at someone's lips, I understand that certain people want them because they obviously want to, increase their, what's the word I'm looking for? Confidence, right? But sometimes I'm pretty sure you've dealt with people that have a very proportionate face, lips perfect. Like, what do you tell those people that want enhancements when they look great? Because sometimes if you do an enhancement, it may throw your whole thing off, right? I mean, I don't know. What do you think on that?
Absolutely. So there's the normal lips, and then there's the Miami lips. And so we have to be careful. We don't want to give everyone Miami lips. And you know what? It's unfortunate because there's a lot of guys that are very protective of their women, and a lot of women that are protective of their women, and just a lot of, in general, misconception because of the way that a lot of these girls are walking around with these huge lips. If I put one syringe of filler in a normal person's lips that has average size lips, for example, like Maaxx, she doesn't walk around with these huge lips. Those are like 2 to 3 syringes months apart.
Mine are super cute now.
But
also, I had before, I said before I started coming to you though, but like I used to have, when I smiled, I didn't have an upper lip anymore. It literally disappeared.
Right.
That's how tiny it was. I don't want those massive lips. Like, I just want that something.
Do you want my lips?
Yes, please. I mean, here's the thing. I would if they were natural, but if he would fill me up to that
Dominican
size,
lips right there.
but if I put filler into that size, it would look insane on me.
Yeah, well, about people with my lips,
wouldn't look right.
It wouldn't work on me.
I've
No,
seen
because
that.
I have a
It'd be too
tiny
much.
mouth.
You actually have a video that you did where you put the filter on and your lips
Oh
were
yeah.
like, and I was like, how big do you want them?
Yeah, I mean, here's the thing. I like big lips, but it has to look.
I like big lips, but I
don't
cannot
mind.
lie.
Yes,
Yeah.
I don't mind people looking at me and like, she
Anybody
probably
with
has
big lips on
lip
her
filler.
face
That's
gets
fine.
sprung.
But if anything, like, have you seen all these girls? Like, they put so much shit that it starts to show on the upper lip, and they look like I don't even know what, fucking
Frog?
monkey or some shit.
I'm all about natural results. Natural results.
Frog.
I try to tell patients, the first few days they're going to be a little swollen, but don't worry because they're going to go down, and then you're going to wish that you had a little bit more.
Exactly.
So the only time I'll do a half a syringe of lips on girls is mostly if their lips cannot accommodate a full syringe because they're so tiny.
Yes.
Unless they've already had filler and they're coming back for a touch-up at 6 months. But to go back to Achilles' question, I want to take someone's face and just bring them back 10 years.
Yeah.
To do what
Or
we
even
can to
that,
make it more plump or enhance any weaknesses they have.
As a competitor, when we diet, we get very lean. And on a normal day, honestly, I don't really care about my face like that. But when I start to diet for a show, my face gets so dry so fast.
Right.
And it's not attractive. Like, so for me to do it for a competition, that's when I really want it. On a regular day, I don't care as much. But like, but I don't mind walking around with nothing at times. Like, it's not a big deal. But for show, definitely I need it. Like, you can see my bones sticking out of my face.
Yeah. Now, how long do these enhancements last, Doc?
So in general, we use the term Botox as an umbrella term, but really that's a brand name drug, and there's 4 neuromodulators: Botox, Juvu, Xeomin, Dysport. All of those medications inhibit release of acetylcholine at the neuromuscular junction, which is required acetylcholine in order for muscle contraction to occur. If the muscle can't contract, if I can't contract my frontalis muscle to raise my eyebrows as heavily, then I won't be able to form those horizontal lines. So in general, the tox drugs last about 3 months. However, there is a new drug on the market that just got FDA approved, Doxify, and
I need to
in the
ask something.
studies, it's lasted 6 months on 50%
Hold on,
of the
let me
people.
play real quick. Go ahead.
6 months on 50% of the people. But then you got to make the argument for what happens if it wasn't injected correctly by someone that wasn't sure what they were doing or too much. Then you're frozen for 6 months, or you have some asymmetry that you may or may not be able to correct, or a lid ptosis, God forbid. But that's the tox realm. On the filler realm, in general, hyaluronic acid fillers will last, in Maaxx's case, 2 months. But for everyone else, 6 months to a year.
But
She is a super bodybuilder, high metabolize. She has a high metabolism. And so the average person, though, depending upon the area of the face that they're injected, for example, the nose doesn't move much. If you inject liquid rhinoplasty non-surgical nose job, that'll probably last on average for about 1 year. However, if you inject the lips, you're probably not going to get a full year out of the lips because you're using your mouth all the time. For some of us that talk a lot.
Oh, that's why they go
Or chew.
Well, Doc,
we got the
you
answer to
just,
that.
I mean, there we go.
So it depends on the area of the face. But in general, it's always good to do every 3 to 6 months, come in for treatments. Some people will come back to me every 4 or 5 months for a little bit of tox. Some people will come back right at that 3-month mark. Fillers, you refill it as needed. You should try to do it once a year. If you have to come in again, you can. But there's a lot of other things that you could do during the process with skin resurfacing, facials, some microneedling to really help keep your skin
Wait, you do microneedling?
fresh. Not at the moment, but very soon.
No.
Oh, wow.
Yes.
Yeah.
I love that. I've done it before. It's been a while.
Wait, is that microneedling facials? Is that what it is?
Yeah, it's like a little. You can.
It's like is it a
better
vampire?
probably,
Is that the vampire facial you're talking about?
That
No.
is the vampire facial.
Yeah.
I actually
Wait.
had that one
Yeah.
time.
No, I thought that was something else. Isn't vampire facial when you like draw your blood and like do
Well,
a facial with it?
they're often doing it with microneedling,
Yeah.
so
Oh,
that you
got
can get better tissue penetration and increase collagen turnover, and then oftentimes will actually take your own blood.
He'll probably get banned on TikTok too. He just said penetration. That's why he got shut down on TikTok the other day. Did you
Beep.
know? Because he was reading
I had a
about
Kama
6
Sutra book out.
Yeah.
positions.
I do what I do on my TikTok on Saturdays is something called Spicy Saturdays. So
Okay.
I have a bunch of girls and we talk about intimacy and like, you know, how to spice up your relationship and things like that. So they kind of like we're like, all right, buddy, you
Yeah.
can't use certain words.
I saw your
So-
spicy TikTok video yesterday.
Which
I
one?
That was the
ruined.
first
I
trap if I've
ruined
ever
his-
seen one.
Which one?
What?
Which one he says? Just the one without him having a shirt on, and just literally, girls are gonna be breaking their necks left.
Nah.
and some guys.
This
too.
guy, forget about it. The guy's freaking stud over here. So
All right, tell
you
me
see how
about
guys always
astrology.
compliment each other?
Yeah, tell him the
Let's
astrology
hear
here.
it. I always
Oh.
used to think astrology was baloney, it was bogus. And then I started reading more about Capricorns, and I was like, wait a second, I really am ambitious. I really always want more. I give everything, my heart and soul, my passion, like, and it's like, that's me. Like, and I read some other ones, and I was like, it's not that much me.
Yeah. Well, I mean, first and foremost, I mean, you're always going to be successful, right? Because you're always in your head and you're your worst critic. So you always want the best out of you, right? And that's why a lot of Capricorns seem to thrive because they're always in their head. They're like, oh, I got to be successful. I'm not doing something, motivation. But you guys enjoy a good sense of humor, number one.
Absolutely.
You like people that lift you up because you like to lift others up as well. And you just have a positive mindset in life in general. So, yeah.
Did you know? Go ahead.
Go ahead. No, please continue.
Did you know my birthday before? Or you literally know about all the signs.
He
'Cause
just
that was
knows
that was
shit.
me
I
to
don't.
a T. to two T's.
But let me just say this, because whenever I've heard you talk about things, like you never say anything negative. There has to be like
there's always a positive
negative
and negative
things to all the signs, right?
Well, I mean, there is a positive and a negative with overthinking, of course, because what tends to happen is, not saying that he does this in particular, but self-sabotage starts to happen, and some people use that as their motivation, to be honest with you. So it just depends.
Try saying nothing negative. Try saying nothing negative for 24 hours and watch your life transform. I love that saying.
Yeah, I like that too.
I love that.
Yeah.
I'm always bad.
You are like that, dude. You're not. You're like you don't really like to hear negative things. You don't like to hear negative stories.
I always try to, even when something is bad, you see it good. I said I used to date a guy who always had a problem for every solution. You know those?
Yeah.
Yeah. No matter what I said, he always had an excuse or a problem with that. And it didn't matter what it was. And I was like, I am losing my shit here right now.
Yeah.
Because it doesn't mean I don't have shitty days. Of course, we all do, but overall.
That's how I felt in the hospital. So I was in the hospital for 7 years. I did 4 years of...
You mean working?
Yeah.
It's like, shit, what
7
did
years, I was very sick. I was in a coma.
Yeah.
So I did 4 years of residency in New Jersey. And then I spent 3 years after that in Miami in the hospital. And I was doing anesthesia 6 of those 7 years. And I had just found myself...
Keep it right here.
I had found myself becoming like all of the others in the hospital. There's a lot of negative energy, and rightfully so. People are sick, people are dying, and nobody wants to be there, especially the patients.
Work there, I think. I don't think.
And so, as the healthcare providers, you have to really be able to deflect that energy and be there and take care of them, because they're there for you. They're there. They don't want to be there. They're there because they need help. They need to be relieved of whatever illness, ailment, surgery that they need. And so I just found myself down a lot more and kind of complaining. And so I'm like, this isn't me. This isn't Jarrett. This is not who I am. And so when I was able to get out of there, I found my soul. I found my personality back. I found my heart. But there are a lot of great healthcare practitioners that are so happy in the hospital, and they're amazing. And I wish that I was able to do that and be like them.
It's a certain person.
Because they're the real heroes. Yeah.
That's crazy.
Okay.
So, go ahead. You go.
I have so much to say.
We have so many questions for Doc.
First,
hey, I'm excited this
every
guy's
time
here.
Today, because I'm...
No. Ladies first, my dear. Go right ahead.
No, sometimes I listen back to our old podcast episodes, and I was like, holy shit, I talk over him all the time.
Wait your turn.
What?
No, it's okay.
I know. I'm sorry. Okay, what is... Actually, it's like two questions. What is the craziest thing you've ever done on somebody's? Now we're going back to like Botox and Fillers and stuff. What's the craziest thing you've done?
Well, you could even say craziest transformation.
What's the craziest things you've done, and what's the craziest things you've been asked to do? Because those might be different things.
Honestly, I can't even think of something right now. Let's put a pin in it and come back to it. I mean, when I was working at the trauma, are we talking about anesthesia or are we talking about aesthetics?
Yeah. I mean, actually, either or, maybe. Just crazy story. We like the juicy stuff.
Yeah.
I'd say the craziest story, or one of the scariest ones, I have about 3 that come to mind with anesthesia. When I was on 24-hour call in the hospital, late night, 3 in the morning, someone comes in. Remember, this is a trauma hospital, so this could be car accidents, this could be gunshots, stabbings, this could be just very sick patients. One of them was not a trauma per se. You know those little spiky balls that are on the beach, they don't come out of palm trees, but they're these little tiny, the size of a little,
what are they called?
This little tip that are all spiky and used to step on the beach.
Oh yeah.
So a guy came in, it was on his fingernail, and he tried to bite it off. And as he bit it off, he inhaled it. And so it went right.
Wait, what?
I'm just trying to wrap my mind how you even managed to do that.
He did it, and it was scary because he was in respiratory distress in the emergency room, and you have to do an emergency intubation, but you don't want to push that thing down his trachea, because if that goes past his vocal cords into his windpipe, you have a serious problem. So we had to have ear, nose, throat doctor come in. And along with him, we both went in together. I put the patient to sleep. He did a direct laryngoscopy, which is essentially when you put the patient to sleep and oftentimes paralyze them, and then you stick this
When you actually had that tool with you.
all the way down,
Yeah.
and you're able to lift off the soft tissue and then place the breathing tube
Wow.
down their trachea so that they can breathe. We actually did a trial, so we didn't put the breathing tube down him. He did a direct laryngoscopy and was able to get it out with a really long utensil. That was scary for everyone involved because we didn't want to make the situation worse.
Yeah.
That's one story. Another one that comes to mind was when a patient came in with his tongue pretty much, it looked like a handgun to the mouth.
Yeah.
But the story was that he bit his tongue chewing.
Huh. Okay.
Sometimes the stories don't always line up, and you just kind of go with it. So we had to have an oral maxillofacial surgeon come in, and I do have some amazing photos. I don't know if I'm allowed to put those up, but they are very graphic, very graphic.
Yeah, hey, let's do it.
So
I just put a warning first where it says fast forward now if you don't want to see
for that kind of situation, when you're going to be working in the oral cavity, a lot of times we'll put a breathing tube through the nose and then into the trachea. But for this particular patient, it wouldn't pass. I made several attempts and I couldn't get it to pass, so I had to go with an oral ray, which is basically a modified form of...
Wait, and it wouldn't pass because why, you think?
There's a number of reasons. There could have been a lot of swelling. There could have been some tissue interference, but you don't want to jam it and then create another problem, and then he's going to be bleeding. So I put an oral ray into the side of the mouth, and the surgeon was able to repair the tongue, but I'll never forget what he said at the end. He's like, this guy's pussy eating days are over.
So wait, was the tongue, was it able to be like repaired somehow?
He did an amazing job.
Does it have like a
He did an amazing
tongue,
job.
or what is it?
He had a venom tongue afterwards.
Yeah, it's pretty cool.
Yeah, have you seen some of these people on social media that are like splitting their tongue?
Yeah.
Why would you want to do that?
Yeah.
I can understand maybe a piercing in there. For some
I have
reasons,
those.
I mean, so yeah, I need to know about this tongue situation.
This is cool.
Yeah.
So how, could you describe it a little bit more in detail on like how bad it was? Because I'm trying to figure out how do you...
If I could put the photo up, I'll put the photo up. You just got to see the picture.
How do you repair a tongue
yeah.
like just all like... That's... Wow.
Does the tongue work? Like, can he taste and stuff with it? Like,
I highly doubt that he's going to have his sense of taste, especially if the glossopharyngeal nerve
he has
had
like
some
a
sort of injury.
constant COVID for the rest of his life.
But yeah, I'll defer that question to maybe oral maxillofacial surgeon. Another interesting story, and then we'll get off anesthesia.
Maybe this is the man who started COVID. He's like, I want everybody to not taste.
So it's always interesting when the patient's story doesn't line up with the outcome. I remember one patient came in one time and he said that he tripped and fell, and this object, a peach, ended up in his rectum.
Oh,
and so,
but hey. Hasn't that happened to us all?
Yeah, I mean, it can happen. It can happen. It's embarrassing sometimes for people when they come in, and you want to be sensitive and understanding of that. So it's also, as the anesthesiologist, you get a lot more information than the emergency room doctor or the surgeon too. So the patient's like, I haven't had anything to eat, or I haven't done any drugs, and I'm like, listen, man, your life is in my hands right now. I'm the last person that you want to lie to. He's like, I had a steak dinner and I just did some cocaine.
Yeah.
Wait, that was really quick. What did you say?
He said I had a full steak dinner and he had done a gram of cocaine that night.
Oh, okay.
And that increases your cardiac risk tremendously. Also, your aspiration risk. There's a 50% mortality rate if you aspirate any of that food into your lungs. So you do a rapid sequence intubation where you essentially paralyze the patient. You may or may not hold some cricoid pressure, which has some significance to helping, but the research is conflicted, but a lot of people will do it anyway, and you get the breathing tube in as fast as possible without actually mask ventilating. So I actually brought my handy dandy mask here. So
keep the mic close, that way they can hear you.
Usually prior to the surgery, we will pre-oxygenate the patient to increase their levels to 100%, and then oftentimes once they're paralyzed, you are ventilating for them, you're breathing for them, you're putting them, and then for this procedure though, you don't want to mask ventilate them because you don't want to insufflate any air into the stomach. As you're mask ventilating them, air's going in through the trachea into the lungs, but it's also going through the esophagus into the stomach. But all these patients have empty stomachs, so it's not an issue, right?
Yeah.
Wrong. If they've had a steak dinner, you have a very big problem right there. So you'll pre-oxygenate them, they breathe in on their own, and then you paralyze them, put the breathing tube in.
Do you need to empty their stomach first somehow?
No, because you just want to secure their airway for the procedure. And then once the airway is secure and the breathing tube is in, do you see this little cuff right here, this balloon?
Yeah.
I can inflate it. I don't have a syringe with me, but I'll pump this up with air and this will fill up like a little ball. And that's going to sit inside of the trachea and prevent anything from coming down. So usually after the breathing tube is secured in the trachea, you'll then pass an oral gastric tube into the stomach and then empty the stomach contents.
Wow.
The interesting story with this was they tried to initially remove the peach by lubrication and hand placement, and they were not able to get. They could get their hand around it, but they couldn't pull it out. And I remember it was a male surgeon at the time, and then the female trauma surgeon walked in, and I said, maybe it needs the hands of a woman.
Yo, this guy had a fun night,
so they were able to succeed. They were able to clamp around it and pull it out.
Steak, cocaine, and peaches in the ass. Like, this sounds like a hell of a party.
This has to be the title.
Yes. Oh, yeah. That's the title of the podcast.
Right there. Yeah.
Steak, cocaine, and peach in the ass. Yes.
Wow. That's very interesting.
That's awesome. Do you have any fun Botox or filler story? Otherwise, I have other questions.
I honestly, there's not like... Most of the patients that come in for aesthetics are healthy people that just want to look a little bit younger, feel a little bit better. So I'll throw up some examples of some of my work that I did that, people are they just don't like how their face looks. Their confidence is gone. They feel tired, old. And so to just be able to line up a before and after photo, someone that has a weak jaw, for example, to be able to give them a jawline, I've seen it firsthand at increasing confidence and making you feel just more physically attractive, which we know is important in life. Many of the CEOs, a lot of the superheroes that are depicted on movies are shown with prominent, strong chins, jawlines. Yeah. Physical attraction matters. It does.
Yeah, for sure.
And these are people that can't get the jawline, no matter what they do, is what you're saying.
Well, I mean, you can always have surgery, but that's the last resort.
But it's not going to come by itself.
No, I mean, with dieting, you could, with
but I think either you have the structure or you don't, right?
Exactly, yeah.
Okay. So that's why I wanted to know.
There's sexual dimorphism between males and females, and there's certain physical features that make someone more masculine, and there's certain features that make someone more feminine. And so a stronger, chiseled, more prominent jawline and chin is classically a masculine feature. Now, for the females, the lower third of the face should be a little bit slimmer. If you see a female that has more of a prominent, strong, squared off face, that's going to make her look a little bit more like a guy.
Yeah.
Yep.
And, there's different areas of the face that you want to look a certain type of way. For example, the brow, a more prominent brow with a straighter eyebrow is classically a masculine feature. Females have a little bit more arch, softer brow bone.
I should add in an old picture of myself because I used to have straight eyebrows. I've actually, over the course of like 10 years, I've plucked them into the shape they are today. Yeah. Because I'm not kidding. They were completely straight before.
No, they look nice. The lateral third of the eyebrow on females has a little bit more of an arch to it, and on guys it's a little straighter. The nose on females, it's more attractive when a woman has a little more concavity to it and a little bit of a lifted tip. On guys, if you did that for a guy, it's going to make him look a little bit more feminine. A straighter nose on a guy, even with a little bit of a dorsal hump, is seen as a little more masculine.
Yes, that's what we took away. Oh, wait, that wasn't really what I had. I had like broken bones sticking out. But I'm going to add in my nose picture in the video too, my before and after.
And then another feature, the chin, for example. On females, we like to have a little bit more of a skinnier, thinner, pointier chin that kind of goes and ends between the borders of the nose, whereas on a guy, you want more of a wider, squared-off chin down towards the corners of the mouth. You don't want it,
What
but just
do you
aesthetically,
think
that's
is
what we
still-
see
'cause
as
I'm like,
more attractive.
What does he have? Like, he has a lot of beard, so you wouldn't even know, right?
He's seen my face before, though.
I mean, I just
I
see a
have
perfect
too, but-
specimen of a human right in front of me.
This guy.
But that's a great way to camouflage as well. As we age, if there's certain things that you can do
Yeah.
to help enhance other features or take your eyes away from problem areas,
Yeah.
like my nasolabial folds. If I shave my face, I look like a mole rat. I look like a little baby. But like if I grow my beard out over
Me
here,
too.
it kind of masks the nasolabial.
That's why I shave my face.
You have beard?
Your hairline too. You can camouflage your hairline. There's so many different things that we can do to kind of take the eye away. And some patients will come in and they just want to do a little bit of Botox, but I'm like, your lips are screaming for me to enhance and plump them for you, and that's going to take the eyes away from that little line in your forehead. And so a lot of times people will come in and they're like, no, my husband or my partner will kill me if I get lip fillers. And I'm like, but just trust me. And they absolutely go crazy. They love it. They can't stop laughing after. But more importantly, when they meet their friends or they see people, the best compliment that you can get from someone is there's something different about you,
Yeah.
and I like it.
Yeah.
And so that's
awesome.
what I go for. That's what
Yes.
I want to do for
100%.
people.
You should just look like you're having a good day.
I think that you've personally changed my outlook on, the whole filler thing and Botox thing, just being around you, because at first it was something that I kind of like dawned on at first. I'm not going to lie. But like working with you and like seeing what you do with Maaxx and all that, I'm starting to understand why this is necessary, So
I was super anti this type of stuff
Yeah, me
until I
too.
was like 34. I'm not kidding. That was the first time ever that I even considered doing anything, because I'm like, bah, this is bullshit. Only this
Yeah.
type of person would do that. Now I'm all about it.
yeah.
I admire and almost envy those who just don't care. My parents, my brother are very different than I am. It's not about vanity. It's not about being superficial. I just, as a perfectionist, I never realized that this is my niche. This is it. This is like
Yeah.
what I'm ambidextrous. I can do things with my
It's
hands
art.
that other
I'm
people
an artist,
can't do.
different kind, but it's an art too.
I see things with my eyes that other people can't see.
Yep.
There's certain things you can't be taught. You can do all the courses and all the training, but that doesn't make you the best. And I'll never say I'm the best. I'll say I'm the second best, because it's too much responsibility to be the best. I want to be amongst the best at what I do, and I want to be able to do it in a way that just makes people feel good about it and breaking the misconceptions. And I want to talk real quick about ambidextrous, though.
Go ahead.
Ambidexterity.
Please.
So
I have no idea
being
what that
able
is.
to use both
hands.
hands is really, really cool. So I'm a lefty. I write lefty, but I do so many things with my right hand. I inject with my right hand. I eat soup with my right hand. I prefer a fork in my right hand, but I use chopsticks in my left hand. Can I put chopsticks in my right hand? Yes. But I just discovered yesterday, last night before I went to bed, I was just curious, and I started writing with my left hand, starting with my right hand, and I have a video of it too. So the top one is with my left hand. The second one is with my right hand, which was a little iffy, and I was like, okay, am I really, trying? Then I wrote with my right hand again on the third line, and it's better than my left hand.
Well,
Wow.
I like it.
I find that very fascinating.
That's
And lastly, just a really quick story about ambidextrous. So when I was a kid, I was a little confused, and I was playing baseball, and my dad and the coach, I always wanted to catch righty and throw righty. And my dad and the coach were like, Jarrett, you can't do that. It's not efficient. There's not enough time for you to take the glove off and throw the ball. And so they started putting the glove in my left hand for me to train myself to catch lefty, because I wanted to throw righty. And so I remember this big game. I was in the right outfield. Let's say it was like the bottom of the ninth. The bases were loaded. We were up by 1. And it was softball, actually.
Yeah.
Pop-up ball to right outfield. Now I'm there. I got my glove ready. What do you think happens?
You catch it with your right hand.
You're the first person to ever say that. I tell the story all the time. I reached up and I didn't catch it with my left hand with the glove. I bare hand caught it in the right outfield and made the out for the game. And everyone was going crazy. I couldn't even open my hand. It hurt so much. But it was instinctive. It was instinctive because I had trained myself to just catch righty. So I always found that to be a fascinating story.
That's pretty impressive.
Now I want to go home and write things.
I'm impressed that you
with my
figured
other
that out.
hand. I don't think I can write with. I'm right-handed. I don't think I can write with my left hand, but I have certain things I can only do with my left hand.
Could you elaborate on this?
I used to be
more in depth,
I used to
please?
be a bartender, and I am very restless. Also, because of my injury now. I'm gonna try because I can't move my wrist.
Okay.
You know.
So
But
we
either way,
won't test
this
it.
is before my injury. This is my hip bone in here.
Yeah.
Either way, I was a bartender and I was always restless. So if the fucking servers were slow, I would run out from the bar and start helping them because I can't just stand around. And I cannot for my life carry a tray with my right hand. I'm right-handed. I can't do it. But with my left hand, I can literally run with a whole tray of wine glasses full. No problem.
I remember my first job when I was 17.
Okay, I'm gonna
I was
try
a
now.
lifeguard,
I'm
but
doing
also I
right
was
first.
a waiter at a seafood restaurant.
Okay, we're gonna write.
It was Dino's Seafood and Fishery on Route 35 in Middletown, New Jersey. And I was still getting the fingering strategy down with the shifting of your fingers on the tray when you remove a glass.
Hold on, Maaxx. I can't. Maaxx, hold on.
And I had accidentally spilled.
We got a monk function here. Maaxx is laughing.
She's
at
trying
us.
to write lefty?
Yeah, it's just not happening.
That's it.
Yeah, let me try that.
So the top one's righty and the second one's lefty. Yeah.
That
And
was
so
horrible.
I spilled glass on the customer, and I was so upset. I was so sad. And so it was a raw bar, a seafood fishery. And so I gave her a bunch of free appetizers, and she saw how distraught and upset I was, and like how like my empathy. I was just like, oh my God, like what can I do? She ended up giving me a really big tip, and later the manager found out that I had spilled something, and he's like, oh, you should have told me. I would have given her some free stuff from the raw bar. I was like. I had already done that, so.
Were you not allowed?
I mean,
Yeah,
I
that's
guess.
horrible,
I don't know.
We can't do this. No.
Not terrible.
This
We
is
do other
this
things.
is with my left. This is my right.
Nice. Let's see.
So. Yeah, so guys,
Okay,
if you're tuning in,
we have a very important question though. Can you do filler in the penis?
what?
We talked about this the other day. Remember?
I don't remember this shit.
I just want to know.
Doc,
I think I've been writing with the
Or
wrong
Botox?
hand all along.
oh wow,
Yeah.
that's really impressive.
That's crazy.
Yeah, very impressive.
I'm not going to really talk about fillers in the penis because it's not my area of expertise, unless we're talking about blood flow in a sexual
Gotcha.
way.
Okay.
Yes, it can be done.
What?
I haven't done a lot of the research on it. I don't really. I'm not too versed in that area, but I would defer to another expert, urologists, and other people that are actually doing it.
What?
At some point, I might. I know that we can do penile shots and clitoris shots essentially
What's a
for
penile shot?
enhancing
Why would I want it in
pleasurable
my
experiences
clitoris?
Oh, enhancing pleasure
with
experience.
plasma.
But if I put filler in my clitoris, it's gonna get bigger, right?
What?
Well,
Is
you
it-
just
I mean,
said that.
Well, no, he said
No?
he said enhance like your
It'll enhance the sexual pleasure. It will get a little bit bigger, and so you will have a little bit of swelling as well. Again, these aren't my areas of expertise, so I
was
wouldn't really
curious.
comment on it.
Wow,
Okay, so let's.
Maaxx.
What? We gotta ask it.
I love
okay.
it. Yeah,
I know
funny.
everybody wants.
Sexual health, though, is definitely something that I'd like to study more about and incorporate at some point into
Oh
practice.
yeah.
Yes.
There's actually a doctor on TikTok. She's really good at that. She talks about things like that. So I actually just started following her. She's very educated.
Oh, we do a lot of chats about this. We can talk about some relationship stuff or courtship or whatever you want.
Sure. I
Ooh,
mean,
that's right.
He does. He really relationship coached me on the last episode.
Yeah, I've been actually doing some research, and I'm actually educating myself more on relationship coaching. It's something that I, stumbled upon, and I'm actually very interested in it. So I've been educating myself on that.
yeah.
Yeah.
So let's grill him a little now.
Like Derek Kessler, he posted recently about having giving all of the advice to everyone, but he's always single. So it's like it's like that Hitch kind of mentality. And same too. I feel like I have a lot of great advice on not necessarily relationships, but more the interaction between guys and girls, and when you're approaching someone in a bar or in a coffee shop, and what to say, how to say it, and how you make them feel, and what the outcome is going to be from that, whether or not they're interested. I mean, we could do a whole chat on that, but basically it's
we
about
have 15 minutes.
It's about body language and saying something relatable. You don't want to make someone feel like you're hitting on them, but you want to just make them feel good. You want to be charming. You want to be sweet. You want to be funny. And the delivery and what you say is always really important. If you make someone feel like they are, like you want to get their phone number, instead of asking for their phone number, maybe say, "Oh, are you on social media?" And then you get their Instagram or something, and you can keep in touch. More people are willing to give you, girls are willing to give you their Instagram than their phone number because they want the follower. And if they have a boyfriend, they just feel like it's less intrusive.
Correct.
Yeah. What do you really feel about social media, though?
I have a hate-love relationship with social media. I've been on it for 10 years now. And it's not great for mental health, especially if you have an addictive personality, because then you find yourself on there all the time and you're seeking acceptance from other people when you don't need acceptance from other people. And then you can work so much on content and videos and editing and make this amazing masterpiece of a post that's incredible. And you know it's incredible, but then you post it and it gets a couple likes and the algorithm doesn't let you show it to everybody.
Maybe we should change it like this. So if you do meet somebody and you don't really want to ask for their phone number, how about you just plan a meeting already? Okay, let's meet that day at that time. And after that, we can talk about the phone number maybe.
Exactly.
Because I agree with this whole Instagram thing, but then you have them on Instagram, and how is that? Then maybe I don't know, somebody, because people think like that today. Whatever they see on social media, they think it's just the truth of everything, which is, I mean, some people, like, I'm really trying to be real on there, but who the fuck knows who are, you know?
Yeah.
And I always tell people that too. Don't even fucking trust what I do. Like, if you follow me and I say something or I do something or I show something, go do your own fucking research.
Yeah.
Because how do you know that what I'm doing is real? You don't.
Yeah. And that also goes along with several things. Social media has given us this perception of what someone needs to look like or should look like. And aesthetically, a lot of these photos are filtered, they're enhanced. Maybe people are using Photoshop. And so for the younger generation, it's really not good for their mental health and what their goals are. They're often unattainable, and they don't need to have more beauty necessarily to, like, they don't need big lips to be beautiful. And so I think just taking more of an approach with just being more cautious and erring on the side of focusing on yourself. If you see a problem, if you see bad habits and toxic behaviors and you're using over and over and over again, and by using I mean social media, then put a time limit on your social media use and make sure you're doing other things to counter that, and make it like a reward. Say you went to the gym, say you read a little bit, you did something good for your mental health, your education, your physical health. Then you could go on social media for an hour, 30 minutes, but time it. Get the post ready ahead of time. If you can afford to have a social media videographer, assistant, outsource. Let them do all that. Because if you have OCD like me, you're going to over edit, and it's going to drive you crazy.
They have a timer for. I think they have a timer on Instagram that you could actually set now.
Yeah, mine goes off. I just.
I think it should be business. Like, I go on he will even say, "Oh, you saw my post I made?" I was like, I didn't, because I'm not looking. I will go in, I check the DMs, check if there is work, do the post, blah, blah, blah.
One of my friends mutes every single person that she follows, and it's amazing. So that, the algorithm can't jump in front of your face and say, hey, look at this right now, because you went on to do something, but then you forgot to do it because you got distracted.
That's a good idea. Okay, everybody, I'm muting you all.
Mute everyone, and then at your leisure, go look at what they're doing.
Yeah.
Yeah.
So.
I agree. Okay, we got 10 more minutes. Do you have something interesting you want to talk about?
I feel like everything we've talked about has been pretty interesting.
Okay, so
Let's talk about the show.
A little.
Let's talk about the show.
The
He was
Courtship?
he was on the show, man.
Yes.
Let's talk about that, how we met and, you know.
What? How? Okay, so
Yeah.
I know his story about how he got contacted, whatever. How did you get into it? How
Over the
did
years,
you-
I had been approached to go on various dating shows, but as a physician during residency, you have 4 weeks vacation split into 1 week increments, various time periods. Impossible to go on a show for 4, 6, 7 weeks,
And
whatever.
where do these people find you? Just on
Social media. Yeah. So finally, when I was an anesthesiologist in the hospital for 3 years, I had a little more flexibility with my schedule, but I still wouldn't be able to go on a show for 4 weeks, 5 weeks, 6 weeks. Who knows how long it'll be.
Yeah.
So I actually left my job as an anesthesiologist. Kind of quit. I left the job to go on the Courtship, knowing that anesthesia was not something I really wanted to continue doing, and I really wanted to launch off in aesthetics. I had been doing it and dabbling with it for years. So basically, I have kind of big balls. I left the hospital as an anesthesiologist, went on this dating show, and then I was the first one eliminated.
Yeah.
Well, you still did great, though.
It was heartbreaking. I was more upset about everything that I had done to get on that show. Everyone was kind of shocked when I told them, because not a lot of the guys, or none of the guys really. I took private lessons in horseback riding, ballroom dancing, archery, left the job as an anesthesiologist in the hospital, spent about 40 hours memorizing piano songs. I learned Claire de Lune by Claude Debussy, memorized the first minute to play for her, learned origami. I was doing all of this stuff just so I can impress her and show her that I really wanted to be there.
Try to impress me.
But I never got to do it. I never got the chance, and I didn't
Do you
even
think you
tell
had
her.
a connection with her, though?
I didn't have enough time to see if I had a connection with her. I had 2 minutes in the beginning, and then another couple minutes, and it's just there's a lot of decisions that need to be made. There's a lot of good-looking, strong, amazing, special guys that she needs to go through, and there's only so much time. So it's unfortunate, but I think it was an amazing experience because it brought me to Achilles, and it connected me with a lot of amazing guys who I really would have never met otherwise.
As I wanted to touch on that, I personally did not like Doc when I first met him, honestly, on the show.
Yeah?
For some reason,
You
it
came
just
out
didn't
a
give
little
it.
different.
I was a little different on there. I was nervous.
You came out different than you are in person. Yes,
I was
agree.
nervous.
Yeah, but then getting to know you, you're an incredible human being, dude.
Yeah.
Like, I was so fortunate to, reestablish that connection with him moving down to Miami. I didn't think I was going to move to Miami anyway, but this guy's a stud all the way around. Great guy, big heart, and very caring. So, and the show is very difficult to, they didn't give him the opportunity to touch on those personality traits, those great personality traits that he has. And I was kind of like, whatever. I mean, they didn't give a lot of the guys the opportunity to showcase who they really were, their background, and I don't feel
I
like...
guess it's hard for them because they have to eliminate somebody, So
Yeah, that too. But even when you come down to a certain number of males, I think they should have, really dove into like their backgrounds and where they come from, and even how they got on the show, and they didn't really do enough. So,
do you guys think that dating shows is a good thing? Do you think you can actually? Do you think people can actually meet each other, meet their soulmate, or whatever?
So a good thing, meet your soulmate. I went out on that show personally, 20% chance of finding love, okay? And 50% of it was for the excitement, the adventure, to be on a live production. Sounded amazing to me. And I guess the rest of the percentage was just maybe it would help my branding a little bit with the aesthetics and put my name out there a little bit more. So it was a combination of love, adventure, excitement, and social media branding. So it's a little bit of everything. But it's hard for me. I'm very picky. I'm very selective. I'm a single doctor in Miami. I've been single for about 1.5 years now. I've been in about 4 or 5 relationships. I've been in love 4 or 5 times in my life. I've dated a bunch. But for me to go on to a show and think that one girl, I only have one option, that I'm going to fall for her and be in love with her, is tough for me, more so me than other people, because I know personally I'm a lot more selective than most guys. I wish I wasn't. A lot of it ties into why I'm so good at aesthetics too. Physical attraction, physical attractiveness really matters. a handful to me. I wish it didn't as much, but it does. But next to that,
That's what you do.
next to that, how's the personality? Are they kind? Are they sweet? Are they loving? Are they a good person? Are they fun? Are they awesome? Do you have things in common? But it's tough. One person, one chance. You walk in a room. I'd say, for me, no, Achilles.
What for who?
When Maaxx's original question.
What?
I said, do you think do you think it's actually possible to find your soulmate?
50, I mean, it's yes and no. It's 50-50. You never know. I mean, you know, a lot of guys go there with the intention of just going there just to go there and expecting nothing out of it, and then they walk out with a relationship. So, you know. It
So
just
wait,
depends.
how did it? Maybe we talked about it before. Did she actually? She ended up with somebody, but they're not together, right? What was it?
I think they showed. They showcased
I actually
it
watched like the first 7 episodes, and
Is
I
it still
haven't
going
seen
up?
I haven't seen the last few episodes, but I do know we started a group thread, the Gentlemen's Club, and so as people were eliminated from the show, they joined the group thread, and so we kind of knew the order at which guys were coming out. But yes, Nicole Remy and Danny Bokikio.
My guy.
I believe they got engaged, but I don't think they're together anymore.
I'm gonna be on a dating show. I'm gonna start it. It's called the Childless MILF.
The what?
I told you this shit.
The childish.
The
Childless?
childless MILF.
no.
Childless MILF. Okay.
I don't know how we came
Kind of
up
like an
with that shit.
oxymoron, or
Oh, okay. That could be a good
I'm just
be a
kidding.
success. You never know.
Baby.
Never know.
I love it. Actually, I'm going to be on a show end of next month. It's called the Master Injector series. I don't even know if I'm allowed to talk about it.
Of course you are.
Right, it's been
I
recorded
didn't sign
already
a
or no?
contract or anything. It's a pilot and a spin-off of a TV like Master Chef. I think it's going to be Master
wow,
Injector.
yeah.
So people are going to be
Ooh,
competing for a spot to go to England to train with one of the greats.
Oh, you won that already.
Ah.
Yeah,
And
he won that
so
show.
It's an educational course where you learn about mastering your craft and injecting, but also there's going to be a competition embedded into it. So tune in. I think it's October 29th and 30th. That the course is. I don't know when it's
We're
going
all
to air.
gonna do shit.
Bro, you won.
I've applied to a
time for
TV
Halloween.
show too. Wait, I told you that, I think. I can't say it on the podcast though. I applied to a TV show.
Oh,
I said
yeah,
I
yeah.
can't say that on the podcast though. I can say that, but I can say more than that.
Gotcha.
Yeah.
Very, very good one. Very
Cool.
good one.
I'm
I think I
excited for
told
you.
him. I don't remember.
I think maybe.
Either way.
I would maybe go on another dating show if the circumstances were a little bit different. If there wasn't really a chance for me to be eliminated immediately, you know, things out of my control.
Why can
'Cause
you be the guy instead?
something like that?
Yeah.
That would be something I would consider if I had more of a
We'll
chance
both
to
come.
being
We'll apply.
on there.
What? What?
Oh, they should do a
This is
dating show
hilarious.
like that where half of the people are women and the other half are men. And then maybe somebody turns out to be gay even though they didn't know that when they started. That's a concept right there.
There's so many dating
In
shows
these
out right
days-
now.
There's a
It's
lot of dating shows.
unbelievable.
In these days, that would fucking work.
Yeah.
Yeah, The Bachelor's winning right now with the dating shows. They're
I have
number
never
one.
seen that.
Yeah,
number one
well,
dating
the
show.
Courtship, you know, The Bachelor meets Bridgerton, we thought it was going to explode.
Yeah.
But it was amazing to just be a part of it.
Oh, it was an incredible
It was cool,
experience.
yeah.
Yeah.
I think it wasn't
So
enough
cool.
drama.
Yeah. It
People
was hard
people
because
like drama.
you know what it was? It was a lot of the guys were just cool, man. You know,
Yeah.
they you know, we had a little bit here and there, but it wasn't that serious.
You know what, the only dating show that I thought was, I mean, I don't know if I would do it, but the one that you can't see each other. You talk through a wall, kind of.
Oh, the blind.
Love is Blind.
Love is Blind, yeah.
Yeah.
I was
That is
hoping
interesting,
that the dating show we were on would be a little bit more like Pride and Prejudice and Jane Austen's original novel that
wow.
became a movie,
Yeah.
because in there the guy, he has 4 or 5 daughters that he needs to marry off, otherwise his brother's going to take over his
You
estate.
wish there were 4 girls.
And so I thought that there was going to be like a curveball or something, like there's going to be like 4 girls, which would have been a little bit more of a dynamic.
And more
opportunity,
competitive.
More competitive.
Men would have been a lot more competitive, and there would have been more drama if that was the case.
Yeah, because if you
Yeah.
like look at Love Island and these other shows, there's multiple interactions going on, multiple guys, multiple girls, a lot more room for drama, a lot more room for love.
but what if? I mean, obviously they would have chosen the right one, but what if there was one that nobody wanted? What if there was one that was like nobody really paying attention? I don't know.
I think you can also get eliminated off these shows too a little, and they have alternates that jump in. You know?
Yeah, they do.
yeah, that would suck.
What's that English? Tune in next week when this bombshell.
For real, I know. Yeah, that was a great experience. Oh my God. But yeah, anything that you want to touch base on before we end? We're about to end in a few minutes, and when you want to give a shout out to.
Grateful, excited to be here. Thank you guys for having me. Yeah. I'm grateful for both your friendships. And
what does he need to get done to his face?
He doesn't need anything.
Tell me.
Remember, 99%, he doesn't need anything. But I'll say need and want. So you don't need anything, but what do you want? When you look in the mirror.
That's what we're going to do. Make it fun.
What do you want to do? What bothers you? What do you think would help enhance your face? Or is there something about your face that you don't like as you're aging, or even when you were younger and it's carried?
They say that beauty is in the eyes of the beholder.
He has like perfect fucking skin and no wrinkles, this dude.
Yeah.
That's why I look in the mirror.
I saw it because I did his damn makeup for this video shoot, and I'm like, damn, are you sure you're not like 20? He's not sure. He could be 20.
I mean, I'm pretty sure with age, I'm going to be like, yo, doc.
He just wants his hair.
Yeah.
Well, I'm going to actually Turkey to get my hair done.
Flip your hat back if you don't mind, so I could just see your face. I'd say you have strong masculine features across the board. Your face is very harmonized and balanced. I honestly don't think...
Need more sleep, probably.
Yeah, I don't think, nothing jumps out that I'm like, oh my God, I need to do that. Because when a patient comes in and walks in the room to see me, it's immediate. I'm like,
yeah.
Oh, it's nice to see. Like, but I'm looking, I'm assessing, I'm seeing, like, and if something is like that and it jumps out immediately, then those are the patients that I'm like, you don't need this, but I want to do this for you to enhance. Like, the first thing you see is just hollow, sunken darkness under eyes, I'm like, there's something we can do for that. Oftentimes, assuming it's not just dark pigmentation. If someone has like a really big bump on their nose, oftentimes you can actually non-surgically with liquid filler smoothly blend that out, so they could try it out first before having surgery. But Achilles, you're a beautiful man. Stop. You don't need anything.
No. You know what? I enjoyed. I'll tell you a story. I went out with Doc probably a few weeks ago, whatever. And we were at a bar, whatever. And there was women that came up to him. I think a few women, I think, and they were like, as soon as they found out that he was a doctor, they're like, "Oh my God, what do you think about my face?" And then he's sitting there, right? He gets up and he's like analyzing. He's like a Picasso. It's insane. He's like, "Yeah, you honestly don't really need anything, honestly." And the way he just kind of like dissects people's face is just master. It's like a masterpiece, dude. It's crazy.
Thank you.
It's crazy.
Yeah, there's different things you could do for everyone. You don't want to overfill people. I brought some like little filler samples so you could see like a syringe. This is just jelly. There's a common confusion between Botox and filler. And I say Botox. This is actually Xeomin. Remember, one of the four neuromodulators.
So we always do semen in my face.
Xeomin, Dysport, Botox, Juvu.
Every time I come there, I'm like, I'm here for the semen.
Yeah.
No, it's not called that.
Jarrett's
I'm just
the
being
only
an
one
idiot.
that's allowed to stick things in my face.
Oh my God.
So
It's
remember,
funny.
Botox, Xeomin, Dysport, Juvu, they inhibit the muscle from contracting. They reduce the muscle contraction so you don't form the lines.
Is that actual male
Jelly.
vitamin D semen, or is it?
This is just a little white powder. A little white powder that we mix with saline bacteriostatic water.
Semen.
And then the jelly is the filler. And there's different types of fillers, different hyaluronic acid-based fillers. There's Radiesse. There's other.
I got a question, Doc. Got a question.
Yeah.
You keep saying hyaluronic acid. I used to use a lot of hyaluronic acid. Now, hyaluronic acid just keeps your face moisturized, right?
Absolutely. It's definitely contributing to the plumpness and suppleness of the face, because as we age, we lose a lot of hyaluronic acid and collagen, and so the face look and the skin elasticity, and it just kind of gets droopy. So with a combination of tox and fillers, and also this is a thread that I brought to show you guys. So we can place suture material, PDO threads, polydiaxanone suture material, and this gets absorbed by the body in 2 to 3 months, and then the lift itself usually lasts about a year or so, depending upon the patient.
Is that the one they put in the lip too? Can they put So before
you could put mono threads near here to stimulate collagen production.
Yeah.
But this particular thread is a fixating thread. There's lifting threads, fixating threads. There's mini threads. There's long threads.
Can I touch that?
But recently, a couple days ago, and actually later today, I'm doing another thread lift. where you enter over here and you come down right in front of the nasolabial fold. And at a 30-degree angle, here you enter one, here you put another one, and then in between you put a fixating one. So these are lifting and then a fixating one. And then you can just pull it up, knot it off, and then it'll heal. It's
crazy.
Amazing. Alternatively, you can actually enter here, and instead of going towards the fold in the face, where you, if you don't place it correctly, if you're inexperienced or depending upon your patient, how thin the skin is, older patients, you really shouldn't do this on if they're elderly. You might see the thread under the skin. You might have skin bunching that could last for a few weeks, so you don't want that. You have to make sure you're deep enough that you don't see that, but not too deep that you're going to miss the tissue and not get a lift. You can actually enter this way and go up into the scalp. And so I think that's what I'm going to do on this patient today, because she's a really young patient and doesn't have a lot of fat in her face, and I don't want to risk having the thread show. But so look, if you lift right here,
maybe that wouldn't work.
You see this fold goes away?
Yeah.
But if I come down here and lift right here, the fold still goes away. So if I lift here and go up into the scalp, it'll still be gone.
Now, what is she getting done
since
she's young? Since you said she was kind of young, but what is she getting done that she needs that for? I mean, what is it? Is that what she needs, like that little spot?
It varies. Most of the girls and guys that are coming to me for threads are complaining about jowling over here, heavy nasolabial folds that you don't want to overfill, and so lifting the cheek up, softening and smoothing and erasing that nasolabial fold and lifting the gel is when a thread's going to really come in handy. A lot of times I can actually also get a lift with putting fillers in the temple and the cheek out here along the zygoma, and filling this and replacing volume loss here and here actually will erase the nasolabial fold on a lot of people.
That's what I wanted to ask.
So
that's good.
Facial harmonization, we start superior, high in the head, laterally out, and work our way down. And then by the time I get here, it's a major no-no if you're going to an injector who's just immediately trying to fill your nasolabial folds. If you have deficits in your lateral superior portions of your face and your temple fossa and in the zygoma of your cheeks. So it's always good to shop around and make sure you go to someone that actually cares about helping you. I honestly don't care about the money.
They can just, I can confirm. Have you done anything? No, you never done anything.
No.
Right? I can confirm, and I say all the time, and I even have friends who now fucking drive from like far away to go to you.
I actually had someone from Puerto Rico recently fly in for me, and I was so humbled and honored.
Wow.
No, but it's like worth it. When I leave now and I'm going to be traveling, I'll definitely be doing my shit when I come here.
Don't cheat on your injector unless your injector is me.
No, but seriously, I said, because the one I had before, I thought she was good, but then after I came to you, I was like, wow, like it was not like this at all. And I would be driving for her before. I drove 2 hours every time. But now I realized that she wasn't doing such a good job.
Yeah. I'm going to say that again because I misspoke. I said, don't cheat on your injector unless your injector is me, because then that means everyone's going to cheat on me. Don't cheat on your injector unless it's with me.
I like that.
With you, yes. Yeah. Okay, we should wrap up. I have one last question now.
Shoot.
Botox in the armpits.
Absolutely.
I've seen that's a
Monday,
thing.
I have another client doing it, coming in for
Isn't that very bad?
Bad because you think you're going to reduce sweating 100%, or bad
because
of
what exactly does it
thermoregulation?
do? I just feel like we're supposed to... I'm a believer in that sweating is good for you.
Sweating is good for you, but what if you're sweating too much? And what if you smell all the time despite wearing deodorant?
But isn't that going to be locked in there somehow?
It's not 100% block.
Okay.
So you're reducing the acetylcholine release from the sweat gland, which is also affecting the sweat glands and everything.
Yeah.
So it's like, I haven't checked the literature on this, but I think it's like 50 to 80% reduction. I'm not sure. Yeah. I'd have to check. But it's not 100%. You're still going to sweat.
Yeah.
But I've had patients come to me, not because they were sweating so much, but because they were smelly all the time. And so by actually treating the armpits, they told me that they stopped their friends that told them that they don't smell anymore. I actually saw it on a
TV show. There was some dude that did it. I was like, what?
Yeah, it's a quick procedure. You numb the area with topical cream, and in less than 10 minutes, you're able to inject. The dose is 50 units per side of tox, and it lasts like 6 to 8 months. So it's good. It's longer than the normal.
Can you put it anywhere?
Can I put what anywhere?
Botox. Could you do it? I just mean like...
You could do the palms.
We're sweating everywhere.
You could do the palms. You can treat migraine headaches, injecting the temporalis muscle. Masseters for jawline slimming on females or people that have TMJ or grind and clench their teeth.
So basically, the Botox prevents you from moving, right?
Yeah.
So what happens if you put it in the palm? Like, can you?
If you have heavy, sweaty hands,
can you still move them?
So the literature on that, I remember reading the study that their grip strength, debilitating sweaty hands. Then
if you're a bodybuilder, maybe don't. But if you're a normal person, maybe it's worth it.
Yeah. There's a lot of indications where you can inject the tox all over your body, and it's a cool procedure to add.
Nice.
It's 1:11 on the recording. It's a sign.
That's right. 11:11.
Okay. Well, thank you so much for coming.
Thank you
We
guys.
can do another one
I
soon
said
again.
1:11 without the 11. What am I talking about?
It's 9:11 today, by the way, where the episode isn't going to come out today. But either way.
But yeah,
Pay
Doc,
some thoughts
I really appreciate you for coming by. You're gonna, where do they find you? Let them know. Social media.
So it's Dr. Jarrett on Instagram, DOCTOR.
I'll write it all in the
JARRETT. And then TikTok is the same, but it's Dr. DOCTOR period JARRETT. Instagram and TikTok are my main platforms. I have a website, drjarretts.com, Dr. Jarrett spelled out. We're almost ready to launch it. And otherwise, come see me in Brickell, Miami for your aesthetic needs. I do free virtual consults, and I have the best prices in Miami. I don't really care as much about the money as I do making people feel good, feel better about themselves, look beautiful, feel beautiful, and boost your confidence. And thank you guys for having me.
Cool. One more question for Doc. What are you most grateful of? Let's end up there.
Oh, that's a good one.
I am most grateful for, I guess, it can't just be one thing, but I guess my health. But it's a lot of things. It's my health. It's my brain, my heart, my support system with my family, the good people and friends I have in my life, the success that I've had and the hard work that I put in all my life to get where I am today. But I'm not there yet. I'm still working harder. I'm grateful to have a chance at life. We could talk about this another time, but I was very, very sick with Lyme disease during anesthesia residency. And I went from the top of my class to almost having to drop out for a little while. And I was able to overcome it. And I'm grateful for my health for that reason.
Do you use BPC 157?
What's that?
It helps Lyme disease.
Yeah.
Actually, it does.
No, it does not. He was explaining something. I was wondering what he was saying next.
So I guess if I had to say number one, I would say my health. I'm like almost 170 now, 170 pounds, but I was like 148, and I was skinny. I had rashes all over my body. I had itching and crawling sensations all over my body for months and months and months. This went on for a year or two. I was sick. I had multiple co-infections, and my body was being hijacked. My white blood cell count was basically non-existent, and I was able to bounce back from that, and I couldn't be healthier right now, and I'm so grateful for that.
Amen.
Health is wealth.
Health is wealth. And there you have it, Dr. Jarrett.
Thank you guys for having me.
Thank you.
Goodbye, motherfuckers.